Okay.
Yeah, amazing. What would
The
be the percentage of hydrogen peroxide you use?
best would be 3%, unless, it's just so irritating or something that you want to dilute it down. It's an interesting point because in this group of patients in Colombia, they were all severely short of breath. And if you're severely short of breath and you have COVID and you're not able to afford to take anything else, you're pretty close to death.
Mm.
And all of them, not all of them, most of them started at 3%, found it a little bit off-putting. And my friend said, well, let's dilute it down. They said, no, 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 no. I'm already breathing better. I don't care. Leave it on there, So that's how. And when you nebulize hydrogen peroxide, literally in a minute or two, if you have a pulse oximeter, you can see your blood oxygenation go up a good 2-3%. Okay, so it's what I call a poor man's oxygen nasal cannula.
Mm-hmm.
So the peroxide nebulization is important. Methylene blue, very important. It violates the laws of orthomolecular medicine. You talked about that. For people that don't know what orthomolecular means, it means trying to replace the things that you're naturally depleted in.
Mm.
So this is one example, probably the only example that I know of, where a completely synthetic drug, really the first synthetic drug ever made, actually in 1876, turns out to have an incredible amount of orthomolecular-like properties, because it basically does the same thing that vitamin C does. And in the central nervous system, it does it better. So a number of studies have shown incredible case histories of patients with septic shock secondary to COVID, not responding to vasopressors, intubated, going into a coma, and coding. And then after they coded, they started the methylene blue, and the patient completely recovered. In this one particularly crazy case, they started the methylene blue, the patient got better, and they stopped the methylene blue, the patient got worse and coded again. And then this time they started the methylene blue and kept them on it for 7 or 8 days until discharge. Those are the three biggies, along with supplemental enzymes: nattokinase, lumbrokinase, serrapeptase, bromelain with N-acetylcysteine. These are all important things to take, especially if you have any elevation of your D-dimer test. If you get your D-dimer down to normal, then those get a little expensive. One that's not expensive, though, is the nattokinase, and I recommend to people, especially in this day and age where they're talking about shedding of the spike protein, new exposures, I say take the nattokinase for life. It's derived from a fermented soy, so it's something that's been a food product in Asia and Japan for eons, very safe, but very effective in actually dissolving the spike protein where it can find it. Mm-hmm. So those are your big ones that I advocate most because they're available, relatively economical. Certainly the methylene blue is very economical. Vitamin C, if you take it orally, is economical. You'd like to get it IV if you could, which costs more and it's more difficult to find. And the thrombolytic enzymes and the hydrogen peroxide nebulization is as dirt cheap, non-toxic, and effective a therapy as exists. So now somebody who has a little more...
Vitamin C, I'm just curious, vitamin C you would recommend, is it like between 2 to 10 grams?
As an oral dose, yeah, something along those lines, maybe a little more than 2. I'd try to, unless you have extremely sensitive bowels, you want to at least be getting 3, 4, 5, 6 grams on board a day. Mm-hmm. Some people that have really sensitive bowels can actually take most of their dose of vitamin C in a large glass of juice or water and just sip it throughout the day. And when you take in milligram doses versus gram doses of vitamin C, nearly all of it gets absorbed, doesn't cause the diarrhea effect, and you're able to get in the whole dose without just, say, taking 2 grams all at once and then having your loose stool that is caused by the uptake of fluid from the vitamin C in the colon. Okay, so no, those are the type of doses we're talking about, not doses, not expensive doses. And again, if you're in a position where you can afford it and find it, then you need to pursue ozone therapies, ultraviolet blood irradiation, and hyperbaric oxygen therapy. Now, hyperbaric is incredibly difficult to find and pretty expensive, but if you have the means, don't give up on resolving your situation before finding and doing a course of hyperbaric treatments. I mean, we have so many other examples of infection, deep-seated infection, osteomyelitis into the bones where people have had it for years. You know, the vitamin C is not touching it, the antibiotics not touching it, nothing's touching it. Put them in the hyperbaric oxygen chamber, push in that oxygen at 1.5 to 2 to 3 atmospheres, oftentimes which you can also administer vitamin C during the hyperbaric treatment. And this is just incredible. It's resolved Lyme disease for some patients. And that's where I think we have an important analogy here. Lyme, I consider to be an embedded pathogen. Okay, it just gets deep inside the cells, probably the different subcellular organelles. And I think the same thing's happening with spike protein. Now, I can't tell you the pathophysiology is the same, but I can tell you that we've had examples in the past of people taking 20 to 21, 50 to 75 gram infusions of vitamin C daily, 6 days a week, with advanced Lyme, not getting better at all until the 20th infusion. And then they said it's like a light switch is on, and then they're fine. Disease is gone, clarification of the blood work, the whole ball of wax. Obviously, something was going on the first 19 infusions. And for lack of a more eloquent way of expressing it, each was getting deeper and deeper and deeper into the cells, a multi-layered approach, if you will. And something now that's recently, well, it's relatively recently come out and it's finally starting to gain some steam, is ozone dialysis, also known as EBOO, extracorporeal blood oxygenation and ozonation. And this is phenomenal because in contrast to regular ozone autohemotherapy or hemotherapy, where you treat 250 to 300 cc's of the blood, an EBOO treatment over the course of an hour to an hour and 20 minutes can actually ozonate your entire blood supply. And in the course of doing that, and this is a really biggie, I don't think it's getting enough attention yet, is there's a dialysis filter in line. And my goodness, it may not sound scientific, but the gunk and the garbage that gets screened out of the blood, some people are so sick when they first get their first one that they can't do the treatment because the blood is too thick to get through the filter and you don't get it. So they need to go on a course of several intravenous vitamin C and other things to loosen things up, if you will, and can come back and do that treatment. But I mean, who would be surprised to know that a car that's 20 years old with 300,000 miles and never had an oil filter change, what do you think that oil filter is going to look like? So these are all some very exciting, evolving therapies. And I might add, sadly, is because of this nature of the spike protein, and we're unfortunately seeing it more and more and more every day, is it looks like it's not going to resolve in a lot of people completely. So something people are going to have to potentially deal with is going through a fairly extensive protein and then feeling better, maybe feeling normal, and staying that way for several months and then gradually relapse. Okay, so obviously there'll be a lot of variability on that, and somebody, the strength of their immune system, how vigorously they supplement good quality supplements after they've undergone their initial treatment protocol. But it's going to be a problem.